So I usually settle on a middle ground of around 7,000.
On those prior occasions where you had performed autopsy examinations, did they included stab and incised wounds?
Many times, yes, sir.
Would you be able to place a number on that?
I would say it's at least multiple dozens, perhaps as many as 100, maybe not quite that high, but certainly multiple dozens.
Have you received any sort of specialized training that assists you in conducting autopsy examinations?
Well, that's basically the bread and butter of forensic pathology. During the fellowship program, you're trained not only to do the actual physical part of an autopsy, but also to interpret the findings that you see during autopsy. And much of it is didactic training, other parts are hands-on, and other parts are basically experience combined with that training and, quite frankly, a lot of reading. But that really is what the whole Forensic Pathology Fellowship is. That's why it's a year-long program.
Are you a member of any professional organizations dedicated to the study of forensic science?
Yes, sir. The American Academy of Forensic Sciences is a multidisciplinary and, in fact, international, despite the American name, group of forensic scientists, not just pathologists, from around the world. There are subsections. I'm a member in the pathology biology section, but there's also sections for criminalistics and jurisprudence in which there are attorneys, even psychiatry. So we have a very broad range of people networking at these meetings and in this in the group of probably 10,000 or so, perhaps more. I don't really know exactly the number of Academy members.
How long have you been a member of the Academy?
Really since residency, so that would be 1986 or 7.
So nearly 40 years.
Roughly, yes.
Have you ever been qualified to testify as an expert in court?
Yes, sir, multiple times in multiple different venues.
How many times?
Probably over 100 at this point.
And you mentioned multiple venues.
Yes, sir.
What would those be?
Those would be state courts in each of the states in which I've worked, being actually South Carolina, where I did my residency training, as well as Florida, Tennessee, naturally, Texas, and Louisiana, as well as federal court and military courts martial.
On those prior occasions where you have given testimony in all of those various courts, have you always been called by the prosecution?
Not always.
In fact, sir, did you have an opportunity to testify as a defense expert fairly recently in Bradford County?
I did, yes, sir.
In a case where I was the prosecutor.
Yes, sir. That's correct.
Sir, is there anything about your background that makes you particularly suited to conduct autopsy examinations in this particular case?
Well, again, this is part of the forensic pathology training. We not only look at cases of drug overdoses and natural deaths, but also the traumas associated with stab wounds, gunshot wounds, motor vehicle collisions, airplane crashes, house fires, etc. Basically, any of the kind of trauma that you would expect to see in a fairly busy jurisdiction, city, I would say. That's what forensic pathologists are trained to do, so it's part and parcel of our training. Some folks like to semi-specialize, sub-specialize, I suppose, in various areas of forensic pathology. We have some folks who are particularly interested in cardiac pathology. These would be the ones that when you have a sudden cardiac death of someone who's apparently healthy and simply drops dead. Others are more interested in the trauma pathology, and I happen to be one of those. I have a fairly extensive experience in plane crashes and automobile crashes, as well as sharp force and gunshot wound cases.
You mentioned jurisdictions keeping you busy. Does this jurisdiction keep you busy?
It does, yes.
How many autopsies do you perform over the course of a typical week?
It varies widely. Generally speaking, since at this point I am the only medical examiner or forensic pathologist in Hamilton County, last year we did approximately 100 autopsies, and that's about our average, but it fluctuates from the high 70s to as many as 200 per year, not per week. That would be impossible.
Thank you, sir. Your Honor, at this time, the state would consider Dr. Caldwell as an expert in forensic pathology.
Yes. Should the witness be recognized as an expert in forensic pathology?
Sir, as part of your duties and responsibilities as a forensic pathologist, do you sometimes get called to locations to assist in an investigation of the death?
Yes, sir.
Were you working on December the 1st of 2022?
I was.
On that day, did you have an occasion to respond to a location in reference to an item that had been found?
Yes, sir.
Do you recall where you went, sir?
To Suck Creek Road.
Where is Suck Creek Road for the jury?
It's borders the Tennessee River and is a bit north and west down to where we are right now in downtown Chattanooga.
Is that in Hamilton County?
It is.
What did you see when you got there?
Obviously, there were quite a few law enforcement vehicles, and off to the side of the road, adjacent to the river, was a hard-shell suitcase that was laying in the brushwood area just off the shoulder of the road. Near that area were actually a couple of deer carcasses that had been tossed out there after butchering. But in particular, this suitcase was basically the kind that you would take on a relatively extended trip. Large suitcase, on wheels, handle, etc. After all of the documentation, photographic and location issues were resolved by the police department so that they could place it exactly, then the question came up, well, what is in the suitcase? And at that point, the cover of the suitcase, the lid was opened. Inside was a black plastic trash bag. And so using basically just hands, I could feel along the contents of the bag and say, yes, this is not animal or something, this is a human being inside there. At which point then the suitcase was closed back up, it was transported to the medical examiner's office, and at that point then we further examine not just the suitcase but also the contents.
Sir, I'm removing from this box item 173, exhibit 173 to the trial. You recognize this, sir?
Yes, sir. This is the suitcase that was brought to the medical examiner's office.
Is this the same suitcase that you observed along Suck Creek Road adjacent to the Tennessee River?
Yes, sir. It appears to be.
So you take this item with what you felt as human remains inside a garbage bag back to your office. What did you do when you returned to your office?
At that point, before we do anything else, then we're going to start doing photographs and x-rays, because we're going to document everything we're doing as we're doing it in a stepwise fashion, because we don't want to lose evidence. So in x-raying, we basically just laid the suitcase on top of the x-ray plates and x-rayed through the suitcase. And looking at those x-rays, it was evident that there is a deceased person inside, basically in a fetal position that is drawn with the knees drawn up and the arms crossed across the chest, and fitted into the suitcase. In addition, along with all of the hardware in the suitcase that shows up on X-ray, there's also a triangular metallic density piece that showed up in the area of the chest. And it's something that obviously didn't belong to the suitcase because there's a very regular arrangement of support bars, rivets, etc., that is fairly symmetrical. So after the X-raying was done, then the body was lifted out of the suitcase, and again, it was in black plastic trash bags. And at that point, then the suitcase is laid off to the side. That's no longer of medical examiner interest, that's law enforcement interest. And then I proceeded to cut each of the black plastic trash bags along one side and along the bottom and remove each of those in turn. Turns out there were 3. And as happens to be fairly common, at least in the bodies that I've done, in cases in which I've autopsied, where people have been disposed of in trash bags, it seems like the interior bag is always pulled up from the feet toward the head, and then there's another one down from the head toward the feet, and then there may be a third one, again, feet toward the head. In this case, turns out it was exactly that same way. I guess that's just how humans think. But, so each of those bags is cut off, removed, and that reveals the body of a young woman who is in a fetal position, has no clothing on the top half of her body, and is shackled and handcuffed. Obviously, there's a lot of blood involved in this, and multiple stab wounds and size wounds. And if I may go on a slight tangent here, when we talk in forensic pathology about stab wounds and size wounds, those are 2 different things to us. A stab wound is deeper than it is long, and an incised wound is longer than it is deep. An incised wound is basically a cut. And that tells us 2 different things. You know, we're not dealing with just a sharp, pointy object, but we're dealing with a sharp, pointy object that has an edge. On the other hand, if you just have an object with an edge, like say, for example, a piece of sheet metal, that can cut you very deeply, but it's not really going to stab you unless it's pointy. So that's the distinction that we talk about. So when you hear me go on automatically about stab versus incised, that's what I'm talking about. Incised is a cut.
Thank you, sir. And you described the process that you went through when you returned to the lab. Do you document those observations and your activities and findings in any kind of a document?
Yes, sir. Every autopsy case, of course, has to have an autopsy report. And that report basically is an objective finding or series of findings describing what I saw. Some people tend to put in interpretations into their autopsy report. I was trained that the autopsy report is purely an objective thing. I saw this. And we leave what it means to later. In addition, we're going to take photographs, because photographs are the best way to document things. We all know that. Picture's worth 1,000 words. So we have photographs documenting not only body position and clothing and personal effects, everything on the body, but also the wounds. And we'll photograph them, as we say, dirty, that is, without cleaning the wound. And then clean so that we can actually see the characteristics, contours, and details of the wounds themselves. Some of the things that we look for in wounds of any kind is this wound an antemortem, perimortem, or postmortem wound? And By that I mean antemortem is guaranteed before death. And what we'll see in those wounds is there will be bleeding into the surrounding fat and soft tissue. Because we all know that. We've all cut ourselves, and we bleed. And there's bleeding into the surrounding soft tissue, as well as out, leaking out of your body. Perimortem, well, let me skip to postmortem. Postmortem wounds occur after death. There is no blood pressure. If there's no blood pressure, you don't bleed. It's pretty simple. So those will not have bleeding into the surrounding fat and soft tissue. A perimortem wound, peri means around. So we have antemortem, perimortem around the time of death, and postmortem after death. Perimortem wounds can have some characteristics of an antemortem wound, but they're not definitively antemortem. And so for those, we say, yes, it occurred at or around the time of death, but not definitively before death. Because when your heart stops beating, you don't stop. Your blood pressure doesn't drop to zero everywhere because you have all these little capillaries everywhere. So you can still leak into your wounds a little bit around the time of death. This is complicated in stab wounds, particularly those where the cause of death, as it is in all sharp force injuries, is hemorrhage, or I should say the mechanism of death. Basically, all stab wounds, unless they actually hit your brain or central nervous system, cause death by making you bleed to death. That's the mechanism. So we look at, all right, what is the blood volume in your average person of this size? And it goes by size. So in a person who is the size of Jasmine Pace, just under 100 pounds, her blood volume is approximately 4 liters or 4 quarts of blood, so a gallon of blood. Now, if you lose about 20 to 30% of your blood volume, that is sufficient to make you unconscious. Anything above 30% is sufficient to actually cause death. So when we look at someone who has 4 quarts of blood, if we lose 1.5 quarts, that's sufficient to cause death. So there should still be some blood left inside the body, but it's going to be spread around in the body and the capillaries. The blood that's in the big toe is going to remain in the big toe. So what we're actually looking at is, where is that 1.5 quarts of blood? And when I'm teaching classes on sharp force injuries, look for the blood, because 1.5 quarts of blood goes a long way. And I use the analogy, everyone has painted a wall sometime in their life. That's a gallon of blood. That's 4 quarts. You can paint a room with a gallon of blood. So if you see a spot of blood this big and someone is dead, there's more blood somewhere else. Maybe it's inside the body, but maybe it's also at another scene. So that's why we say, look for the blood, because until you have found all that blood, you don't really know where the bleeding occurred.
Sir, did you prepare an autopsy report of your examination of the body that you found in the suitcase?
I did.
I'm handing you what's been marked for identification as Exhibit 202, if you had an opportunity to review this document.
Yes, sir. This is a copy of my autopsy report on Jasmine Pace.
And is that something that is prepared and kept in the regular course of your activities as the medical examiner for Hamilton County?
Yes, it is.
Your Honor, I would move to admit into evidence Exhibit 202, the autopsy report.
So admitted.
And sir, specifically this autopsy report, who is the person that was examined?
Jasmine Nicole Pace.
Thank you, sir. You also mentioned, as you were testifying a little while ago, that you took x-rays of the suitcase.
Yes, sir.
I'm handing you what's been marked for identification as a collective exhibit 1 to 4, number 203. Would you take a look at those?
Yes, sir. These are copies of the x-rays that were taken at the medical examiner's office.
At the time of Jasmine Pace's autopsy?
Yes, sir.
Your Honor, I move to admit into evidence 203, 1 through 4 as a collective exhibit.
So then,
And finally, sir, you mentioned the taking of photographs as part of the autopsy examination. Would you mind taking a look at this collective exhibit, number 1 to 27?
These are some of the photographs that were taken at the time of Jasmine Pace's autopsy at the medical examiner's office.
Do they fairly and accurately reflect what you observed during your autopsy examination of Jasmine Pace?
Yes, sir.
Your Honor, I move to admit into evidence 204, collective 1 to 27.
so then,
Thank you, sir. Doctor, there's a couple of terms throughout your autopsy report that I think would be helpful. You've already explained a stab versus an incised wound. What does superficial mean?
Superficial means that it does not go very deep into the body. It stays on the surface. And these are injuries that basically, for the most part, we would just stick a Band-Aid on it and move along. Some of them may verge, of course, in the continuum from superficial to shallow, and then shallow may require some stitches, or deep. And the deep wounds would, of course, require actual repair, surgical repair or surgical intervention of some sort. So just as we divide stab wound or sharp force wounds into stabs and incised, we also have superficial, shallow, and deep wounds.
So a superficial incised would be a wide but very shallow cut.
Right. Well, more specifically, a long but very shallow cut.
Long but shallow.
Yes.
What about penetrating?
A penetrating wound is simply one that goes into the body. Again, we have our own verbiage and jargon. Penetrating wounds go into the body, but they don't come out. Perforating wounds come into the body, go through the body, and come out. So sometimes those are called, particularly in gunshot wound cases, they're called through and through, but that's not really a term that we like to use because it doesn't really tell you. So penetrating goes in, and perforating goes in, through, and out.
Is there a particular way that when you are describing injuries on the body that you can differentiate between right, left, up, down on the victim's body? Like how would you orient a person that you're conducting an autopsy examination on?
Every description that we do starts in a standardized fashion. That way, any forensic pathologist in the world really can look at my autopsy report and know what I'm talking about. So we have everything done according to what we call standard anatomic position. And that is standing upright, arms down to your sides, palms toward the front. Now, most people don't stand like this, but the reason we do that is because no bones are crossed. If we have our palms toward the back, we're actually crossing the forearm bones. That's the only reason that it's done like that. But everything is done in reference or described in reference to standard anatomic position. So when I say the wound is on the right, that means it's the decedent's right, not my right. That occasionally gets a little dyslexic confusion when you're looking at somebody, but that's what we mean when we say right versus left. We mean the body's right versus left.
Thank you, sir. And with that, did you take those x-rays that you made into evidence as Exhibit 203 before or after the body was removed from the suitcase?
Before.
I'm displaying on the screen behind you, and there's a laser pointer. This is 203-1. Could you please tell the jury what we're looking at in this photograph?
Well, we can see the outline of the rim of the suitcase. Here are the zippers here. Part of a handle mechanism here, one of the latches. This is a bracing rod in the shell of the suitcase. This area here is the logo on the top or the lid of the suitcase. And here you can see this is obviously a human skeleton in here. In the fetal position, this is an arm, thank you. This is the arm, here's the spine coming down here, the ribs we can see here. And here is the triangular metallic object that doesn't belong there. It's not part of the suitcase. We see another arm here, and a couple of the rivets and screws, etc., that go up to making up the suitcase itself.
And sir, you mentioned the metallic logo that is the rectangular object, it looks like, in the middle portion of the skull. Would you mind pointing it out on Exhibit 173?
That is actually this logo here inset into the lid of the suitcase.
So Jasmine Pace's body was oriented head up if the suitcase was on its wheels.
Correct. In the position the suitcase is right now, her body is with the head upward, facing toward the courtroom.
Thank you. Sir, I'm now showing you 203-2. Could you orient us to this photograph?
This photo is moving over a little bit to, if I can point to the suitcase, to this area here that we're x-raying. And again, we see another one of these reinforcing ribs, a few more rivets, etc., etc., a zipper pull on the inside. And here we have a knee. You can see the kneecap here and the lower leg, the shin, and the fibula that goes along with it. This is the thigh bone. Here you see a hand, or the bones of a hand, and you can see the top of the skull as well here.
Thank you, sir. Now 203-3.
And we're moving downward on the suitcase in basically counterclockwise fashion to this area down toward the wheel on the side closest to the courtroom. And we see again that reinforcing rib, zippers, rivets, etc. But we also see handcuffs and shackles, as well as another metallic device here, which is actually a bracelet. But you can see on this one, there is a chain that extends here, and there is no chain coming off of this particular one. And we're down here to feet. These are the foot bones, feet and ankle bones down here. So we have forearm here, the two forearm bones, and arm and forearm bones here. And so we're down here. This is her buttocks.
203-4, sir.
And we're moving over, obviously, to the last part, which is down here. And again, we have all the accoutrements or the hardware of the suitcase. We see a bit of pelvis bone here, the lumbar spine here. Again, one of those shackles that we saw in the previous x-ray. And so we have basically, by going counterclockwise, we have a complete picture of a small individual. At this point, we didn't know male or female because still inside the suitcase, still inside those black plastic bags.
Now, turning to your autopsy examination report, specifically the second page, you provide a description of the decedent in the fetal position inside the suitcase with 3 bags, and the victim was then removed from those bags. Was the removal process documented?
Yes, sir, it was.
Now showing you what's been previously admitted into evidence as Exhibit 181-1. You recognize the individual on the right?
Yes, sir, that would be me. And here is actually the body of Jasmine Pace still inside the trash bags. I'm cutting, as I said, along one side and along the closed end so that the bags can be sequentially lifted off and removed from her body.
Showing you 181-2, is that a continuation of this process?
Yes, sir, it is.
And 181-3.
And here we are actually getting to the inner trash bag. And now we actually can see, obviously, a hand, right hand, handcuffs, and this is an ankle and foot.
Thank you, sir. Going now to another portion of your autopsy report. Is it broken down into various sections?
It is. Typically, what we'll do in order to make it more readable is, at the very beginning, we have a brief outline that says what injuries were found. And then we go into an injury section where we separate the injuries. Sometimes we do this by body locations, such as head and neck, and then another paragraph for torso injuries, and then another for extremity injuries. In other cases, like particularly for gunshot wounds, we'll take one gunshot wound and we'll say gunshot wound A enters here, goes through this body cavity, does this damage, exits here, and then move on to gunshot wound B. But we try to keep everything sort of in a logical, readable progression, And in a traumatic death, the injuries are the most important part of this autopsy. So that section comes first, right after the outline. And then we go to the normal, if you will, dissection part of the individual organ weights and what they looked like and were they healthy or not healthy. And then at the very end, we'll get to what specimens were taken and what findings we got from that.
So in this case, you indicated that the handcuff and shackles were part of the general evidence of injury.
That's correct.
Were there photographs taken of the shackles and handcuffs, sir?
There were, yes, sir.
Showing you and the jury 204-1, what are we looking at here?
These are the handcuffs, and you can see this is Jasmine Pace's right wrist and left ankle, and these are handcuffed together, and you can see these are not law enforcement handcuffs. These are what you buy at Spencer's or something like this. This is not heavy duty at all. And in fact, they have actually started to rust. In addition, you can see over here, we have a better photo of it later, the shackle that is actually connected or was connected to this shackle over here on the other ankle and the area of the right elbow, or right forearm and elbow.
Now, sir, what's the significance of the white item that somebody is holding towards the bottom of this photograph?
This is our case number and ruler. Because we're interested in documenting everything, all of our photos, almost without exception, are going to have a scale of measure in them, and the 6-inch gray plastic ruler is a standard throughout the profession. And we're also going to put our case number on it. Now, we have a case number system or a database system that automatically assigns case numbers. We get a call for a death, we assign a case number to it. It generates it based on the year, which is 2022, the month, which is December, and the date, the 1st. And then the following 3 numbers are randomly generated, so the 666 just happens to be generated that way. So all of our photos, except for very, very close-up photos, will have the scale and the case number in them.
Thank you, sir. Now, 204-2, what are these items?
These are the handcuffs that you just saw a picture of on her body. And again, you can see that these are not the typical law enforcement handcuffs. In fact, there's a little lever on each side that can be used to release them. So these, again, are something that would be novelty items as opposed to anything that was used for serious purposes.
Sir, I'm handing you what's being marked for identification. That's 205. Do you recognize this?
The labeling on this bag is not it's not medical examiner, it's law enforcement labeling, but I do recognize the description of that.
Would opening it help familiarize yourself with the contents?
Certainly, we can do that.
It's right there next to you, if he needs it.
Thank you.
You're welcome.
This internal clear plastic bag has the label from the medical examiner's office with the description Handcuffs, Jasmine Pace, along with our label and the seal, etc. Would you like me to actually remove the handcuffs?
Yes, sir.
They are still wrapped in the surgical towel that came from the medical examiner's office.
Do we see that towel in 204 too?
Yes, sir. That's actually what those are lying on. You can see the edge of the towel up here. And again, these are not the typical law enforcement handcuffs. They're simply cheap steel, chrome-plated.
Thank you. And those are the same cuffs that we saw on the screen.
Yes, sir, that is correct.
The same cuffs that we can see here. Appears to be right hand, right foot.
Yes, sir.
Okay. Thank you, sir. There's another item up there, 206, sir, if you wouldn't mind going through the same process with it.
2 minutes.
Your Honor, I'll move to admit into evidence 205.
So moved.
And within this paper bag, we have again a clear plastic bag with the medical examiner's office label marked as Shackles Jasmine Pace. And these would be those that were, or the shackles that were removed from her body at the time of autopsy.
What's the difference between handcuffs and shackles, sir?
Handcuffs would have a short chain on them, and shackles would have a longer chain. Basically, the intent is to allow you to walk with shackles. So you obviously can't handcuff someone's ankles together, they can't walk. But by the same token, if you shackle someone's wrist together, that gives them a fair amount of space. So the chain length would be basically the big distinction. There's obviously many different models, types of shackles, but these, like the handcuffs, are not the typical heavy-duty law enforcement type. They're, again, the sort of novelty type of cheap chrome-plated steel, and you can see that it's basically almost a lamp chain as opposed to a heavy-duty chain, and these would fit together like that. So the chain length isn't very long, and these, both of these have still some blood and rust on them.
So, sir, I'm now showing you 204.3 are the shackles that you just held up to the jury, the same ones depicted in 204-3.
Yes, sir.
Where were the shackles affixed to Jasmine Pace's arm?
In the case of the shackles, it was not to the left arm, but it was to the right elbow, or the forearm just below the elbow. So her left hand and arm were actually free. They were not bound.
I'm showing you this admitted into evidence as 204-19. Could you tell us what we're looking at in this photograph?
This is Jasmine Pace's right elbow area. You can see this would be the tattoo on her shoulder. This is her actual elbow here. And you can see two lines of rust, basically, along with the pattern of that chain, again, with a rust pattern showing where the shackle was. And in fact, you can see, I think, where the double part of the shackle is over here, right at the inside crook of the elbow.
Sir, what is the substance darker in color that's adjacent to the measuring device that you have held up to the elbow?
This right
Yes, sir.
here is blood that has dried. The lighter, more yellowish is rust. Now, some of this is rust and blood mixed because, again, her body is wet, and so the blood tends to creep everywhere by capillary action. So basically, the entire outside of her body has a thin layer of blood on it. And blood being very oxidizing, I guess is the best way of putting it, does prompt rust. So it's not surprising then that these handcuffs rusted in a wet environment being exposed to blood.
Thank you, sir. Going on to the external examination of Miss Jasmine Pace. 62 inches is what in feet?
5 feet 2 inches.
98 pounds, obviously, is just measurement of weight. How would you describe Miss Jasmine Pace's build?
She's a small, fairly thin young female.
You also describe down here genitalia atraumatic with a menstrual pad in place. What's that mean, sir?
The external genitalia, that would be obviously the labia minora, majora, etc. Atraumatic means there's no trauma visible. So there's no damage, there's no lacerations, abrasions, etc. There is, of course, blood because there's a menstrual pad in place. So rather than a tampon, she's actually wearing a pad.
Was that item collected?
It was, yes, sir.
Turned over to the police department?
Yes, sir.
From Annie, it's been marked for identification as 207. Please tell us what item 207 is. You don't have to fully remove it, just you recognize the item.
I do. This is the gray underwear that Jasmine Pace was wearing at the time of autopsy, and in it is the menstrual pad that's adherent to the crotch of the panties.
Your Honor, I would move to admit it to evidence 207 and 206.
So then,
during your autopsy examination, were you able to determine whether Ms. Pace was on her menstrual cycle?
She was, yes, sir.
Thank you, sir. You mentioned in your autopsy report on page 2 that the injury locations are consistent with the decedent's fetal body position as found. I'm going to show you now 204-4. Is this the condition and positioning of Ms. Pace after the final interior garbage bag, I think it's garbage bag number 3, was removed from her body?
Well, it's actually open. She's lying on it, so it hasn't quite been removed. At this point, because she's not even 100 pounds, I just picked her up, moved her off to the side so that we wouldn't disturb any of the garbage bags. So just physically lifted her. But this is her position, and you can see from the x-rays that this position is documented by the x-rays that we took of her still in that suitcase. But this is obviously a fetal body position, basically knees drawn up, arms drawn up, and in as small a size as possible.
Now showing you 204-5. What does this photograph depict, sir?
This is after she's actually been removed from the plastic bags and is laid on the autopsy table itself before removing her clothing, the handcuff shackles, etc. Here you can see the position that she's in, where her right arm, you can see just the edge of the shackle around her elbow area. Her right arm and wrist is tucked between her knees, crossed at the ankles, and her left arm is basically free.
So when you wrote down that I want to make sure I don't misquote you, the injury locations are consistent with the decedent's fetal body positioning as found, I don't see any stab wounds up there. Can you explain that?
Well, this is actually showing, as you can see, this is the left side of Jasmine Pace's body. The stab wounds are virtually all on the other side of her body. And when we look at the other side of her body, in this position, basically we just rolled her over, all of those stab wounds and incised wounds are clustered in the area of her head, neck, shoulder, and upper torso. They're just all on the other side of the body. So this side of the body, as you can see, basically has no injuries.
So when you say consistent with the fetal body position, what do you mean?
Well, if we have, in a fetal position, by tucking our legs up and getting ourselves into as small a ball as possible, some areas of our body are protected, relatively speaking. Others are exposed. And if you have your knees drawn up, obviously she's not quite as tightly compacted as she was inside that suitcase. If you have your knees drawn up, you're basically protecting your abdomen and the lower part of your chest. If you have your arms crossed, again, you're protecting your chest. But what you're doing is exposing your shoulders and your back. And so the stab wounds clustered on the other side of her body are all in that area that is exposed if she's in that position. And they're all pretty much about from the area of where your rib cage comes together at your solar plexus up. In fact, there's very little that's even below the level of, say, the armpit. So this is all from head, neck, shoulder, upper chest, well, upper back, really, and virtually nothing below that except for that free left arm. Because that free left arm, if we roll her over, that free left arm is up here. The right arm is way down here, as you can see, tucked in between the legs, and there's no injury down there on the legs. So that's protected. It's out of the way. The left arm, however, is not. It's free and it's folded up across the chest.
Sir, you mentioned earlier that part of your job as a forensic pathologist when conducting an autopsy report is to look not only at the physical examination of the decedent, but also other evidence.
Yes, sir.
Have you had an opportunity in this case to look at other items of evidence?
I have, yes, sir.
Is one of them a photograph of a blood stain?
It is.
I'm showing you what's been admitted into evidence as 127-4. Have you seen this photograph before?
Yes, sir, I have.
Is there any medical significance to the stain that we see in item 127 to the physical evidence that we have as 173? Oh no, I'm sorry, not 173. 158. Carpet.
When I first saw this photograph, it immediately struck me, and I think I actually blurted out, that looks like a Shroud of Turin. And what I saw here was basically a recreation of the bloodstain pattern, or a bloodstain pattern that I would expect to see if someone is bleeding in that fetal position that we saw. Because we have the feet and legs down here with the knees drawn up, arm down here, other arm here, head here. Now, obviously it's not exact because it's being absorbed and spread a little bit, but the shape is very, very consistent with not only the positioning of Jasmine Pace's body, but also the size of her body. And so if we look at the size of her body, the positioning of her body, and look at the stain, they overlay fairly well, actually very well. Now, can I say that's absolutely her blood? No, I don't know what testing was done to match that to her. But the stain is extremely consistent with her body as found.
Based upon your anatomical observations of her size and shape?
Yes, sir. Because the dimensions of her from her head down to her buttocks and from her back to her knees and feet, etc., that matches this very well. And as you can see, we have scales of measure on this piece of evidence, which was done by law enforcement, as well as the scales of measure that we have at autopsy. So it's very easy to match sizes because we have a scale of measure in both different photographs.
So, sir, you mentioned both different photographs. I'm now displaying 204 and 127-4. You mentioned node measurements. Do you see node measurements on the left 204-4?
Yes, sir. In fact, we have two of our rulers in this photograph. So if you were to basically flip Jasmine Pace's body over, rotating it on her feet, and just flip it over, she would fit into this stain very nicely.
So, sir, in your expert opinion, Exhibit 158, where's Jasmine Pace's head?
On this actual exhibit,
Yes, sir.
her head is,
Yours, feel free to stand up if you want a better view.
if we look here at this area, that's this area right here, and that's where her head is going to be. Her head and shoulders are right in this area.
You mentioned legs and buttocks.
And similarly, this is going to be her back with her knees drawn up. There's a foot, knee, and arm.
Specifically, which arm?
That's most likely going to be her left arm.
And why would you say most likely be her left arm?
Well, that's the arm that not only has the injuries, but it's also the arm that is lying, or is, excuse me, I said left arm, I meant right arm. That's the arm that's got the injuries. The left hand and wrist has injuries. The right shoulder has injuries. So this would be most consistent with the left wrist area. I believe I said that correctly without confusing myself.
Thank you. During your external examination of Ms. Pace's body at autopsy, were there signs of obvious injuries?
There were.
Let's start with the head and neck. Do you, in your autopsy report, work from head down?
Yes, sir.
First injury you document, sir, on page 2 of your autopsy report is a 1.5-inch, slightly curvilinear stab incise wound at the vertex of the scalp. What would a curvilinear stab and incise wound look like?
Well, we have our stab and size wound, and obviously since we have stabs and we have incised wounds, there's got to be sort of a middle ground where it's kind of stabbing and cutting as well. And so that is a stab and size wound. Curvilinear means it's not absolutely straight, but it's curved. And it's not irregular, it's linear. So we have a curved but linear wound that is a combination of a stab and incise wound, and the measurements all refer to the length of that wound. And the vertex scalp is the top of the head. It's at the vertex, the most vertical part of the body. So at the top of the head, we have this wound on the scalp.
I'm showing you now 204-6. Is that injury depicted here?
It is. If we look, here is her forehead. Here's her nose. So just to orient you, so this is forward, and here's that wound. You can see that it's got stabbing characteristic here, and then it slices. So that's where you get the curvilinear stab incise. So the blade's going in, it doesn't penetrate the bone, it just goes down to the skull, and then it cuts backward.
Thank you, sir. The next injury you describe is a 1 3/4-inch stab incise wound on the right forehead above the eye. Sir, I'm going to show you 204-7. Would you mind pointing that out to the jury?
That would be this wound that we see here. And here, obviously, now we've got what we call clean pictures because we've removed this, washed away as much of the blood as we can. And now we can see the characteristics of the wound themselves. This is that wound that we're talking about. And you can see there's a blush of bleeding around these wounds. So again, these are wounds that have some blood pressure with them, but you also see the underlying fat here. Our fat is yellow. It looks like chicken fat, quite frankly. And so when we see yellow fat, that's indicative of not much bleeding going into that area. So the combination of that blush of blood and the yellow fat would mean this is more likely a perimortem wound.
And again, what's perimortem?
Perimortem is at or around the time of death. There's not full blood pressure at that time. So she's bled enough to drop her blood pressure down. She's in the dying process, but she's not yet dead.
Thank you, sir. Next injury you describe is a 1.18-inch stab incised wound to the left forehead. I'm now showing you 204-8. Could you please describe this injury to the jury?
Here is that injury. It basically cuts across the eyebrow and goes under the brow ridge itself into the eyeball itself, so that her eyeball is actually ruptured. So the wound track here is downward and backward.
Next injury is a half-inch irregular stab wound. What is an irregular stab wound?
That's going to be one that isn't linear, doesn't have the usual characteristics of a straight stab wound. We've all cut up our food and prepared food. If you take your knife and you stab it into the roast beef, that's going to be a typical stab wound. If on the other hand you sort of wiggle the knife around as you're doing it, that's going to leave an irregular stab wound.
Now showing you 204-9. Please describe the injury to the jury.
The philtrum, by the way, is that ditch in the middle of your upper lip coming down from the nose. And here you can see it goes here, then curves, then goes down, and then curves. So this is a knife that is, it's a stab wound, but it's hitting bone and being deflected. So that's why you get this curvilinear thing. In addition, that skin is not uniformly smooth because you have the philtrum. So you have a peak and a valley and then another peak coming up, as well as the bottom edge of the nostril. So the contours of the face are very irregular and you're hitting bone, but not penetrating deeply into it. That's what makes it an irregular stab wound.
Thank you, sir. The next injury is a 3/8-inch stab wound to the chin, just left of midline. I'm showing you 204-10.
And this is that stab wound, and you can see it's very regular, very consistent, very smooth, very linear, but it's not very big, so it doesn't go very deep. But this also has that blush of hemorrhage around it.
And when you say hemorrhage, you just mean bleeding?
Bleeding, I'm sorry.
Oh, no.
Yeah, hemorrhage means bleeding.
Thank you, sir. Next, sir, you go on to describe a large number of stabs to the side of the head and neck. And for this, you may need your autopsy report to explain them. So here's Exhibit 202. I'm now showing you, sir, 204-11. Could you orient the jury to which side of Jasmine Pace are we looking at?
Obviously, this is the right side of her head, right here, eye, top of the shoulder down here. Here you see her left hand, which we'll get to momentarily. But you can see all of these individual stab wounds and stab incised wounds that are occupying the right side of her head and face. These don't go any deeper, basically, than what you see. They don't penetrate into the skull until we get down to neck wounds. Even this double stab wound in the ear here only goes to skull. So her brain is remaining intact. So there's no actual brain injury at this point. These are basically stabbing into muscle, soft tissue, etc.
And because it's not penetrating the skull, would any of these injuries be immediately fatal?
They wouldn't be immediately fatal, but obviously with this number of stab wounds, there's going to be a lot of bleeding coming from them because the head is a very vascular part of our body. And any one of us, particularly bald people, who have bashed your head somewhere know scalp wounds bleed. They bleed a lot. And facial wounds also bleed. So these are going to do quite a bit of bleeding. When we get down to these wounds in particular, these are significantly deeper. This one just behind the ear and at the lower edge of the jaw. They don't cut into large arteries or veins, but they do go deeper, and so they do cut through a lot more muscle.
Doctor, are these injuries that we see on the screen, 20411, slashings?
Well, they're mostly stab wounds. Some have stab incise characteristics. That is, the blade comes in, and as it's coming out, it doesn't come straight out, but it cuts its way out and back. So instead of going straight in and out, it's in and then out at an angle. So you have more of an incised characteristic to, say, for example, this one. In this particular wound, this is a good example of where you have that little curved edge here, which would be the initial penetration, and then the cut coming out as the blade deflects, hitting skull, etc. So when you see this little fishtail,
when you say a fishtail, what are you talking about?
this little double peak thing that you see along here, we don't see it in every stab wound. What we're looking for is basically the contour of the knife, the cross section, if you will. We look for a blunt edge, that's going to be the spine of the blade or the back of the blade. In a single edge knife, a double edge knife, of course, will not have a blunt edge, but a thin single edge blade frequently doesn't show you a good blunt edge. The other thing we're going to look for are the fishtails, as you can see here and here. And that's because things are in motion. As the knife comes in, it creates one of those little fishtails, and then a little bit of motion as it's coming out creates the other fishtail. So you have one coming in, and then a little rotation, and one coming out. So that tells you the edged part of the blade, or the edge of the blade. Even if you don't have a good blunt edge to see, that tells you where your sharp edge is.
Sir, if Miss Jasmine Pace was in the fetal position at the time of the infliction of the injuries, are you able to tell anything about the, I guess, direction from which the penetration stab occurred?
Well, these are all going away from us, and with variable degrees of forward and backward or downward, for the most part downward. Some of these on the skull, they're shallow enough that it's hard to get a good directionality, but they are all coming from her right to her left, and for the most part a bit downward.
Next, sir, you describe a injury to the right side of the neck with a 1/4 inch stab wound with 1/8 inch anterior blunt edge. It penetrates completely through the neck before exiting and transecting the thyroid horn as well as the jugular. Sir, I'm showing you now what's been admitted into evidence is 204-12. Can you please tell us what we're looking at here?
Well, for orientation, here we have the top of the left shoulder. Obviously, this is the neck. There's that stab wound on the chin that we saw before. This is actually one wound pathway. It comes in here and exits here. In the course of this, it actually cuts across the larynx or the voice box, and your larynx has two cartilage horns that stick up. Those are called the laryngeal horns. And they're about the size of a pencil lead. And the one on this side, the left side, is completely severed. In addition, the jugular vein, which sits right next to the carotid artery, is also transected. By transected, we mean cut in half. So it's completely divided. The blade actually goes through the top of the larynx and cuts through the epiglottis. The epiglottis is what closes off your airway so that you don't choke to death on food. So it's basically a thin flap of cartilage about the size of your thumbnail, and as you swallow, it flips down to close the larynx and the trachea so you don't get water into your lungs. So that is cutting right through there. The interesting thing is that it doesn't actually cut through carotid arteries, even though the carotid runs right next to the jugular. So it misses the carotid and it severs the jugular. The important thing to that is the jugular vein is a large volume of blood, but it's at low pressure. So you don't bleed as fast from a cut of the jugular vein. In movies and TV and books and stuff, they always talk about, oh, he cut his jugular vein and blood spurted out. No, blood doesn't spurt from a jugular vein or a vein cut, it flows out. Arteries are the ones that are under pressure, and that's where the blood spurts. In this case, the arteries were not damaged in the neck.
Now, doctor, can you tell, since it was a entrance on to our left, okay, on the screen, and exiting on the right side of the screen in 204-12, are we able to glean anything about the size of the knife?
The knife is going to have a relatively broad blade, but relatively thin. And by a broad blade, I mean that from the spine to the cutting edge is going to be wider. So this is not your average steak knife or anything like that. It's what most people would call a butcher knife. Actually, it's a chef's knife. And it's the kind that when you're watching the cooking shows on TV, when they're rapidly chopping their onions, that's what they're using, is a chef's knife. And so those are going to have a fairly wide and fairly long blade. And the reason for that wide blade is to get the handle up off of the cutting board. That's the only real reason that it's that shape. The skinny blades are going to be more slicers. And if you're a knife nerd, then you know exactly what I'm talking about, but most people are not.
I showed you 204-13. What is this?
This is actually the exit side of that wound, and you can actually see through it to the autopsy table on the other side. Here is part of the larynx at the base of the tongue itself, the root of the membrane that holds the tongue. And you can see there's a couple of ragged areas here. So the blade is not a quick in-out, it's an in with some motion. Not necessarily twisting, but some relative motion. Not a lot, because as you can see, this is a pretty symmetrical wound coming out. But it's coming in from the right-hand side and coming out toward us.
Doctor, the injuries that we just saw on the screen, it bisected the larynx with the hole on both sides. Would that affect a person's ability to vocalize? Talk?
you're above the vocal cords themselves. Those are buried down in the larynx. So you can actually make sounds, but because the sounds that you would make are not just made by your vocal cords, they're made also by the back of the throat and the tongue, but you now have that air escaping out of the sides. And so what used to be one pathway is now three. So in combination with that, we have bleeding, and a fair amount of bleeding. And so that blood pouring into that area is also going to affect the ability to vocalize, at least vocalize in anything intelligible other than just sounds, wheezing, gasping, bubbling, that sort of thing.
You also mentioned damage to the thumbnail-sized flap, I forget the term,
The epiglottis,
the epiglottis, that was damaged as well because of that wound.
yes.
What would the end result of that be with blood beginning to come out of the jugular vein?
Well, you're not able now to close off your airway. So now the blood is flowing down in your airway from that jugular vein. Of course, it's also coming out of the neck on both sides, but it's flowing down into your airway as well, down your trachea into your lungs. So that's going to fill your lungs with blood. It's not to the point of, quote, drowning in your own blood, but you are inhaling blood and filling your lungs with blood.
Thank you, Doctor. The next injury you describe is an injury to the left posterior neck with a 2 1/8-inch stab gun without an identifiable blunt edge. I'm now showing 204-14. Tell us what we're looking at here, Doctor.
This is the back of Jasmine Pace's head and neck. We're obviously just within the hairline here, so we're up at about this level. And you can see this is, again, a stab and size kind of a wound where you can see the layers of skin, fat, muscle, and you're almost down the skull. But there's a lot of muscle back here in the back of your neck. And so this does not actually go down to damage the skull. This is basically as far to the left as the injuries get. And certainly, given her position, and this being right across the back of the head and neck, it can easily be done from the right-hand side as well.
Are we able to tell anything from the coloration of the wound and the area skin around the wound that we see on the screen?
Yes, this is one of those that would be certainly a perimortem wound. You don't see any blush in the skin around it. The skin itself, the cut edge, shows almost no bleeding, a little bit up here. The underlying fat is still quite yellow. And the superficial layers here of the fibrous tissue have almost no bleeding in there. So this is definitely going to be a perimortem wound. It's possible that it's even post-mortem. But again, this is just a gradation. There's no rigid distinctions between them, because obviously when you're bleeding to death, you don't bleed to death all at once. It takes a little while.
Thank you, Doctor. Next, sir, you begin to describe injuries to Jasmine Pace's torso. And you describe it as a cluster of stab wounds on the right upper back from the base of the neck to the level of the axilla. You then describe the individual injuries themselves. Showing you now 204-15. Could you please show the jury where those injuries are?
Well, we've already discussed the head injuries. We haven't yet discussed the arm injuries, so we're in this area right here. So from the base of the neck down to what's called the posterior axillary area. The axilla is your armpit. And you have two folds of skin, the anterior or the front and the posterior or the back. And you see that when you lift your arm up and look at yourself in the mirror. You've got basically two columns that define the front and back of your armpit. So this would be the posterior axillary area, and so we're looking at this cluster of stab wounds.
So, sir, the cluster of incised wounds on the upper back with a 1 1/4 inch horizontal stab with a discernible blunt edge at the web of the neck would be where?
We're in this area right here.
So that's the injury that you described there?
Yes, sir.
Okay. Next, you describe a horizontal 3-inch incised wound and a similar horizontal 1 3/16 inch stab incised wound, which are above the scapula.
Yes, that would be this fairly large wound here. You can see it's still fairly regular, but it has some irregularity to its contours.
You then mention a pair of horizontal 7/8 and 9/16 inch wounds just below the spine of the scapula.
Those are these wounds here. When we talk about the spine of the scapula is your shoulder blade. And we're not talking about the spine of your back, but the shoulder blade is a sort of triangular shaped bone. And in its upper portion, it has a ridge of bone that goes sideways. That's what supports the back of your shoulder. Your shoulder is not actually connected to anything other than your scapula and your collarbone. So that ridge of bone that runs horizontally is called the spine of the scapula. So we're not talking about the spine of the body, but of that one bone. And that runs in this area along, well, right about here. And on some people, you can see it if they're thin enough. You can see that spine of the scapula. You can sometimes even make out the shape of the scapula itself. But that's what we're talking about.
And finally, sir, you described an oblique 1 5/8 inch stab wound in the posterior axillary fold.
That would be back here.
So that wound right there.
Yes.
Sir, are you able to tell anything from the direction of the knife into Miss Jasmine Pace's body if Miss Pace was in the fetal position as found?
Well, the position that you're seeing here would be the wounds are all following the same basic directionality. They're all going from right to left, variable degrees of front to back, and variable degrees of up and down, but not deviating very far. So there's not any that are going sharply downward or sharply upward. They're going basically right to left, some a little forward, most of them not really backward at all, until we get to some of these other wounds here. But these, including the neck, would be going to the left and a little bit forward, which would be in that position downward relative to the ground, if she's in that fetal position.
So, doctor, what we see on the screen with 204-15, given the fact that this is the underside of the carpet, would Jasmine Pace's body be oriented so that her head and right shoulder would actually be up?
Well, up from, what we're looking at is the back of the carpet, so everything is flipped. So her right side, the side that we're seeing here, would be the side that is actually touching the fuzzy side of the carpet, the side that you walk on.
So we would need to flip it over.
Yes, what we're doing is we're looking at the reversed image, if you will, because we're looking at the back of that carpet. So if we make the carpet transparent, if you will, and then lay it here, that's what we're seeing.
So if we were to fold the carpet,
Over 10.
if we were to fold the carpet back over, you describe the wounds as touching the fuzzy part of this physical exhibit. Is that correct?
Yes, sir.
So if we were to flip it back again, just to orient ourselves, you described your head as being here,
Correct.
meaning that Jasmine Pace's head would be at this location, but the injuries would be down.
Correct.
Fair to say that she was not at this location when she was stabbed.
Not during the stabbing, but placed there while she was bleeding heavily. So if she's there during the stabbing, I mean, the blood's going to flow out of her. But if she's lying on her left side, as opposed to her right side, the blood is going to flow into her body cavities because there's no holes for it to flow out of the body cavities on the left side of the body. So she has to be actually stabbed and then rolled into that position, and then the blood flows out. Now, she could have very easily been a foot over this way and simply rolled over after she was stabbed, but obviously you can't stab from underneath the carpet, but we have to have a packed way for her blood to come out. And so that means that she has to have the right side of her body, all of these injuries, to allow the blood to leak out of her body or flow out of her body. So that puts her with this side of her body against that while she's actually bleeding to death.
Thank you, sir. Next, you describe a gaping complex wound with an oblique 2 3/8 inch stab wound crossed by 2 vertical stab wounds of 1 1/2 inches in the mid-scapular region. You describe the blade penetrating the scapula, entering the oral cavity through the 3rd intercostal space and the 4th rib, which is splintered. You then state that the end of the knife fractured off and remains in the lung. I'm now showing you 204-1. Would you please point out that knife blade to the jury?
This is the end of the knife. It's a little bit rotated. It's not flat on, but this is where it is in her lung.
Thank you, sir. Now going back to 204-15, would you please point out the gaping complex wound that you described earlier?
That's this wound right here. And you can see you've got one pathway here, one there, and then there's another here. So you've got the big wound and then the 2 crossing wounds. And the dark area here is actually going into the chest cavity, the pleural cavity. So when we perforate the scapula, as it goes in and comes out again, and it hits the 3rd intercostal space. The intercostals are the muscles in between the ribs. So the 3rd rib has the 3rd intercostal space below it, right above the 4th rib. So when we say the 3rd rib down and the 3rd intercostal space, and then the 4th rib, what we're talking about is the area of muscle in between the 3rd and 4th ribs, and then the 4th rib is actually splintered by the blade. So it's not just a cut through, but it's splintered into multiple fragments.
Sir, are there any vital organs inside the pleural cavity?
Certainly the heart and lungs. In this case, the knife blade actually goes into the right lung, and it's snapped off with the end of the blade actually propped up against the fourth rib, with the tip of the blade still embedded in the lung.
How deep into Jasmine Pace's chest did that knife blade penetrate?
Well, if we look at the end of the knife blade that's broken off, I believe it's 2 inches, if I'm not mistaken. Fractured section. So we have the 2-inch long section that is embedded in the lung, plus the chest wall, or the ribs, plus the chest wall, plus the scapula, plus the muscle and skin of the back. So we're looking at 3 inches or so of the knife actually going in before the 2-inch section of blade actually breaks off and is completely within the chest cavity. There's none of that sticking out visible in this hole. It's actually all the way down in there.
Now, sir, I'm going to draw your attention to another injury that we see closest to the ruler. I have another photograph of it. It's 204/27. Are we able to infer anything from this?
This is one of those stab wounds that doesn't really have a good blunt edge to it. Again, this is going pretty deeply into the body, and I believe this one is the one that goes into the shoulder just above the axilla and fractures the second rib posterolaterally, and that means the back side, or the side and back of the rib. So what we're looking at here, here's the armpit right here, and so this blade is going forward and a little bit upward, and it hits the back of the second rib and breaks it.
And when you say upward, is that using the standard anatomical description, like up towards head, or are we talking up from ground?
No, we're talking up towards head. Again, standard anatomic position.
Just wanted to make sure I wasn't confused. Doctor, were you ultimately able to recover the knife blade from Jasmine Pace's chest?
I was, yes, sir.
So I'm handing you what's been admitted into evidence as Exhibit 177. Would you mind opening that up?
This is the cup that contains the broken end of the knife blade as recovered at the time of autopsy from the medical examiner's office. And we can see that it has the general contour of what you'd expect to see from a chef's knife. I can't tell you exactly how long that blade is because they vary in how wide they are. But you can see the very tip end of it is broken off, and that was not recovered at autopsy. But this part of the blade is all the way embedded in the chest. If we assume that my fingers are ribs, then in this case the knife isn't like this through the ribs. If the lung is here, the knife is actually, or the tip of the end of the knife is actually all the way in and propped up against the inside of the ribs itself, embedded all the way into the lung.
Is that injury fatal?
It's certainly likely to be eventually, because there is a large hole from the chest wall into the pleural cavity, that is the chest cavity. There's no longer a vacuum in there, and our lungs rely on having a vacuum inside our chest cavity to expand. As our diaphragm goes down when we breathe, it creates more vacuum and air gets sucked in that way. If you make a hole in there, we no longer have a vacuum. So then that right lung basically becomes non-functional. There's still blood flowing to it, and so of course it's bleeding, but it's not doing you any good in exchanging air because you can't get any air into that collapsed lung. So the only lung that's working for you is your left lung.
Thank you. That was that other injury that you already described, Doctor. I'm sorry. Next, you describe a contusion 3.5 by 1 inch to the right chest. Showing you what's been admitted into evidence is 2 of 417. Can you please point out the large contusion 3.5 by 1 inch?
That's this contusion here. It actually has a little blood blister in the middle of it. This is the back of Jasmine Pace's torso. Her front is here. You can see her armpit here. And this is the right upper arm. And here is this large pink to red contusion.
Do contusions form, post-mortem?
Well, blood has to flow into a bruise. A contusion is a bruise. And so blood has to flow into the area because what you're doing to make a bruise is crushing tissue. And when you crush tissue, you actually rupture capillaries, and the capillaries leak into that area. That's how we get a bruise. And so you actually have to have blood pressure to flow into the area of damage before you get a contusion.
So how long does it take for a contusion such as that to form?
It can be a matter of minutes, depends on what the blood pressure is and how much damage is done. Obviously, you damage more capillaries, you're going to get more bleeding, and so the contusion is going to become visible. The other thing that matters in the formation of a contusion is how deep is it, which again goes back to how much tissue did you crush. A small bump may not pop up a bruise until later on that day, possibly even the next day. But you fall off a ladder and you give yourself a really good whack, you're going to have that contusion by the time you pick yourself up. So again, a lot depends on how quickly or how much damage is done will depend on how quickly the contusion or bruise shows up.
Sir, in this case, how deep was this contusion?
This one goes through skin, through the subcutaneous fat, and just to the outer layer of chest wall muscle. So this is a fairly deep contusion. It's not one that involves a lot of the chest wall muscle, but it's not trivial either.
When you say it's not trivial either, are you able to describe the amount of force that would cause that kind of injury?
Well, the amount of force is frequently asked, and as forensic pathologists, we don't like to do that because there's a lot of variables involved. In this case, we have a thin young woman who doesn't have a lot of subcutaneous fat, so the amount of force it would take to cause that contusion may be different than a robust male or an older person, et cetera, et cetera. So this is, again, not something that is likely to come up in her from just bumping into the counter. This is going to be like a fall against a counter or a blow or something that is going to get her attention, if you will, not one of those where you hit your elbow and you didn't notice it, and then later on you realize, oh crap, I gave myself a bruise.
You mentioned get her attention. What kind of, I guess, physical effects could an impact like that have on a person?
Well, it depends again on the amount of force and whether you're ready for it, if you will. But certainly it's going to stagger you for a bit. It's not necessarily going to knock you out or anything, but there are other bruises on her, particularly on her neck area, that would be more likely to cause, if not unconsciousness, at least semi-consciousness.
Could it knock the wind out of you?
It could. Typically, that's caused by a spasm of your diaphragm, but a blow there can cause you to have that wind knocked out of you effect, which is your diaphragm suddenly quits moving because the nerve in it has been overloaded and basically gets short-term electrocuted, and so it spasms down. That's why you can't breathe, because your diaphragm doesn't work.
Thank you, sir. You mentioned bruising to the neck.
Yes, sir. On the front of Jasmine Pace's neck, there's a number of abrasions and faint bruises, but the abrasions aren't associated with any stab wounds. And typically, this would be an indicator of we need to go and do a formal layer-wise neck dissection looking for things like manual strangulation. But if you already have a stab wound that goes clear through the neck, there's going to be bleeding into those neck muscles that we would be looking for. And so that basically negates the use of those neck muscles. We call them strap muscles because they're thin and flat. And the only other things we would be able to use would be the larynx, typically those thyroid horns that we talked about that stick up and are about the size of a pencil lead, or the hyoid bone. And in young people, that's problematic because young people are flexible. We all know this. And in a young person, your hyoid bone isn't yet fused. It's still in 3 pieces. So it's very flexible. You can squeeze it from the side and it won't break. The larynx is the same way, very flexible. You can squeeze it. When you get old and you start to calcify these things, then they become rigid and brittle, and that's where we'll see fracture. So in her case, in Jasmine's case, there's no fracture of the hyoid bone, but it is quite flexible, and there's no fracture of the thyroid cartilage, except for the knife blade cutting off that thyroid horn. But again, she has a very flexible larynx. So can I tell you that she was manually strangled? No, I cannot. The only thing I've got is the abrasions on the outside of her neck, a little bit of surrounding contusion that may be associated with it, but don't have to be.
I'm showing you 204-12. Would you mind pointing out those observations that you just made to the jury?
This is what we're talking about here. You can see these reddening areas along here. Those are bruises, because bruises, again, is just bleeding into that area. And you can see it around here, too, where we have that blush of hemorrhage. And we actually have some abrasion on the front of the neck. And remember, there's no clothing on. So we have unexplained bruises and abrasions on the front of her neck. They may indicate a degree of manual strangulation or choking, but I can't tell you definitively that that is what happened. It's simply that that's a marker that is consistent with that and frequently seen during that.
Thank you, Doctor. Next, moving on to the extremities, you described an injury to the right shoulder with a 3.5 by 1.25 complex incised wound compromising 4 incisions. I'm now showing you 204-15. Could you please point out the injury that you're describing there?
This is that injury, and you can see that it doesn't go very deep. These are slices. And you can count them in there. There's 1, 2, and you can see how it slices up here. So we're actually slicing up sections of skin and underlying subcutaneous fat and a little bit of muscle of the actual shoulder itself.
Now, Doctor, I'm going to zoom in. Are you able to tell us anything about the color of the injuries and redness to the surrounding area?
Well, if you look at these areas in here, there's more redness to it. You can see this is nice and red here. This is the one that goes all the way through the neck. But look at how yellow this is relative to the amount of yellow fat displayed in this one. So this is going to be more of the antemortem side of that wound. So we have, that gradation going across from antemortem to perimortem. In her case, I don't see any definitive post-mortem wounds. I see perimortem wounds that are probably right near death. But again, death doesn't occur instantaneously. You're bleeding to death, and so it's a relatively slow process.
Thank you, Doctor. Next, you describe mid-portion of the shoulder with a complex 1 3/4 by 1 1/2 stab wound with 4 separate stabs. Going back to that same photograph, 204-15, could you describe the location of that?
This is actually that wound. It sort of has the shape of a Z, but you can see there's 1, 2, 3, and then a 4th one right there. This wound is actually one of the more damaging wounds because unlike this wound here, which is more dramatic, if you will, this time the knife actually penetrates into the armpit. And in your armpit, you not only have a bundle of nerves called the brachial plexus, you also have artery and vein going into your arm and providing blood to your hand. So in this case, not only the nerves of the brachial plexus, but also the artery and vein of the brachial artery and vein are damaged and severed. So now we have not just venous blood under low pressure, large volume, but arterial blood, high pressure. So this wound is going to bleed pretty significantly. A lot of that blood is going to be internal, but it's going to work its way out. And the internal bleeding is going to come about because the multiple layers of muscle will sort of close over and block off a lot of that bleeding. But because we have that Z shape, where you're cutting not only with the muscle fibers, but across the muscle fibers, that's going to be more open and allow more bleeding to occur. So this one is going to bleed pretty significantly.
Thank you, sir. Next, you describe just below the complex wound, bleed 1 3/8 inch stab wound with a 1/8 inch blunt edge. Both this stab wound and the complex wound penetrate the axilla as described to the jury. Sir, showing you, going back to the same picture, 204-15, where is that?
There we have this wound, which goes upward in the arm and actually gets into the axilla as well. So these two are creating a fairly large amount of damage into the muscle of the upper arm going into the axilla or the armpit area and doing a lot of damage to the vasculature and nerves in that area.
Thank you. Next, you describe an injury to the right elbow with a 1/4 inch superficial incised wound with surrounding abrasion. I don't believe that we have a photograph of that, do we, doctor?
I don't believe so, but it's actually on the elbow itself, superficial wound, a little bit of abrasion around it.
Would it be a fatal?
It would not be, no, sir.
Next, sir, you describe a right wrist with a 2 3/4 inch incised braided contusion on the ulnar aspect with a 1/2 inch contusion on the radial aspect. I'm showing you 204-18. Would you mind pointing that out for us?
This is the contusion on the ulnar aspect. Actually, here, this is the one we were just talking about.
Oh, okay.
The bones of the forearm are the ulna and the radius. The radius goes to the thumb. And so the thumb side is the radius and the ulna, the little finger side is the ulna. So if we look at the outside of our arm, forearm, that's the ulnar side. And so this bruise here, this contusion, is going to be the one on the ulnar side. There's also another one on the radial side or the thumb side.
You mentioned the thumb side with a 1/2 inch contusion on the radial aspect. Sir, would you mind pointing it out?
That's right here,
Next to the tattoo.
next to the tattoo with the handcuff.
Judge is 204-20.
Sir?
Next, sir, you describe a incised wound to the right palm with a 1 1/4 horizontal incised wound of the distal undetermining just proximal to the ring and middle fingers. I butchered that. Sir, would you mind pointing out that injury?
This is that injury. You notice all the wrinkling of the hand that whenever we're in water, we all see it. We call it washerwoman skin. More formally, it's immersion changes. But the undermining is what we call the term used when the blade scoops under the skin and cuts. And we've all done it to ourselves. But in this case, you have sort of a curvilinear shape here, and instead of a stab going in and through, it's more of a slice. But it doesn't come this way, it comes this way. It comes from the palm toward the fingertips. So that's what that distal is. Distal means toward the outside, proximal means toward the core of the body. So distal undermining means that the wound itself is cut this way.
Is that the only injury to the right arm and hand?
Yes, sir.
Thank you. Next, we move on to the left arm. No injuries to the upper arm and forearm.